Hedi, I am Cheryl Tress, the RN for Lake Babine Nation. Irene, Barry, and I will be discussing the vaccine that will be available to our members very soon. We apologize for the technical issues with the last video, so we are recording it again so you're able to obtain the right information. So the vaccine we will be getting is the Pfizer vaccine. The Ministry of Health decides how the vaccine is rolled out in BC. We are very grateful that they have chosen our Lake Babine Nation communities as a priority. Because the Ministry of Health is the one who decides who is eligible and when, the decisions they have made are above our Chief and Council, Emma, First Nations Health Authority, and Northern Health. So we will be starting with elders 65 plus on reserve very soon. We are actually calling out these appointments for Wayeni and Tachet today, and we will be starting on Wednesday and Thursday for Wayeni and on Friday for Tachet. So my staff will be calling all of the elders to gain some information and provide some education on the vaccine. Also, for any elders who have questions, please provide me your name and number, and Dr. John from Carrier Sekani will be calling you to answer any questions you have. So now I'll discuss some of the medical aspects of the vaccine. So the vaccine is available for adults 18 and up. The vaccine has not been tested on pregnant or breastfeeding women or youth and children, and so for their safety, they are not eligible at this time. If you have had COVID, you are still recommended to get the vaccine because you can get COVID again. Once you get the first of 2 doses, you will still be required to continue social distancing, wearing a mask, and washing your hands. This is because the first vaccine is not fully effective. A month later, you will get the second dose. About 10 days after the second dose, most people will have 95% coverage against COVID. Some common side effects are soreness, redness, and swelling at the site. Other more common side effects are tiredness, headache, fever, chills, muscle or joint soreness, nausea, and vomiting. These side effects can last for 1 to 2 days. It is important to note that the vaccine does not cause COVID, and you cannot get COVID from the vaccine. If you develop respiratory symptoms after getting the vaccine, it is likely that you had the bad timing of getting the vaccine and COVID from someone or somewhere else at the same time. If you do have respiratory symptoms at any time, whether or not you had the vaccine, you still need to start self-isolating and call 811 to get your COVID test. After the elders receive their vaccine, we will be having some of the health team calling the elders every day for a few days after the vaccinations to ensure they are doing well. For any elders who may need medical help, the team will let me know and I will be able to contact a physician for follow-up. The nursing team will be working closely with our Health Director Emma, Associate Health Director Mary Lynn, the EOC, Chief and Council, First Nations Health Authority, and Northern Health to ensure the vaccinations are given out safely. So there are multiple stakeholders in this to make sure that we are able to provide it efficiently and safely to all the communities. We are able to provide rides to elders who need it. Once you receive your vaccine, you will have to wait for 15 minutes afterwards for your safety. In addition, for the safety of everyone, you will be given a medical mask to wear. This mask has to be worn throughout the duration of the appointment, covering your mouth and your nose. This is to keep others around you safe, including the nurses and doctors immunizing, as well as the support staff we have. By protecting us, you will protect all of the people we care for. We are very grateful that our most vulnerable members are being prioritized for their safety. As for the Fort Babine Clinic, that will be coming up at the end of the month, and that will be a full community clinic. There is a lot of organization that goes into that. For the population on reserve from 18 to 64, that will be coming in the end of March. In addition, off-reserve members will be covered by Northern Health, and they will be starting their vaccinations next week. Please continue to stay safe, wear your mask properly, use hand sanitizer or wash your hands, and take care of your loved ones. The end is in sight, but we still have to be careful until everyone is vaccinated. And now Irene will provide a translation of this in Carrier.